utility gloves. So this is what utility gloves look like. Ours are green, so they come in blue as well. Okay, so maintaining infection control while gloved. This is very, very important. This is why we wear an over glove, okay? So remember, if you're touching x-rays or a chart and they become contaminated, if you don't use an over glove. Just like that video that you watched, Is Saliva Were Red? You could see how blood will transfer on the x-rays, will transfer on the chart, saliva will transfer on the chart or on the x-rays as well. The assistant was using the phone, so it could go anywhere, and so that area is now contaminated. So we're going to also use the overglove when we're opening a drawer or a cabinet. You could use a paper towel also when you're opening a drawer, that's fine. Or to set up before procedures, you could use a paper towel, okay? It's best when you're setting up for a procedure to always have a pair of tongs or cotton pliers available in case you do forget something inside the cabinet. You have the overglove on, and then you'll have the sterile tongs or cotton pliers to go ahead and take out what you need, okay? All right, latex allergies. Again, page 55 you should be at. So we do get allergies when we wear gloves. Some patients, some employees are allergic to latex. So we need to know if there is an employee or a patient who is. If that's the case, we want to make sure we remove those gloves out of that operatory and far away from that patient or employee. If it's an employee, we want to make sure we get rid of the latex gloves altogether. Be out of the office, okay? There's an increased use of latex gloves and other products that contain latex, has made patients and healthcare workers hypersensitive to allergies. An example is irritant dermatitis is a non-immunological process, okay? This is caused by contact with a substance that produces a chemical irritation to the skin. And what are the symptoms? The skin becomes reddened, dry, irritated, and cracked. Okay, it also can be very itchy too sometimes. So we want to identify and correct the cause that may reverse the irritant dermatitis, okay? So what causes it? Frequent hand washing, okay, that's what we do. With soaps or antimicrobial agents. If you're not rinsing your hands enough, that could cause dermatitis as well. So make sure you rinse your hands very well, completely. Sometimes gloves have cornstarch in them, especially the latex ones. That could be an irritant. Excessive perspiration on hands while wearing gloves. Okay, that may happen as well, especially if you're doing an intense procedure and it's taking longer than it should. Sometimes you get, perspiration. And then again, not drying your hands completely after rinsing your hands. So again, dry your hands completely after you wash them. Okay. So here are some slides what the dermatitis looks like. Okay, slow down, sorry. Irritant dermatitis. It kind of looks like a little red rashy, slight tint of red all over the hands. Okay, that's the irritant dermatitis. That's the beginning stages of dermatitis. Okay, and then here's another one. This one's more involved. She's got it on her knuckles, okay, and on the inside of her thumb and on the tips of her fingers, okay. It could look like that, or it could look like that one. This one is a little bit more severe dermatitis than the other two slides. So this patient has it all over. So again, how do we correct it or identify it? which we just went over, frequent hand washing, not rinsing the soap off your hands completely, any cornstarch powder, perspiration, and again, not drying your hands. So we got the type 4 allergic reaction, which is the most common type of allergy, which of latex. And again, this one actually involves the immune system, and it tends to have a delayed reaction between 48 and 72 hours. Say you went to the dentist and you had a procedure done and you're allergic to latex, and somehow you forgot possibly to notify them or to remind them that you do have a latex allergy. There should be a red flag on the medical history saying latex allergy, but just to be mindful that you look at the chart always to see if there's any types of allergies, okay? Again, it could be red, it could be itchy rash that'll appear, and usually it's limited to the area of contact with the latex, so it would be just on the hands. And this is caused by chemicals used to process the latex. And that's what causes the breakout. Okay, this is what the type 4 allergic reaction looks like. So it's more severe, a deeper redder color, okay? And this one's very itchy, more itchy than the dermatitis. And I'm thankful in my career, honestly, I have not had any type of dermatitis with my hands. So that's amazing, to be honest with you. So just be mindful what you need to do to prevent these dermatitis reactions. This patient or employee, should say, has a hypersensitivity of latex. Okay, hers goes all the way up a little bit higher than the glove. So this patient is hypersensitive to any type of latex. Okay, so then we have the type 1 allergic reaction. And this one is the most severe type of latex allergy that can result in death. So again, if you know somebody that's a latex allergy, remove those gloves out of the office. Okay, again, this one involves the immune system, and this one reacts fast, 2 to 3 minutes. And the reaction is a response to the latex protein in the glove, not a chemical used to process the latex. So it's the protein inside the glove. So the signs to look out for. Okay, so you want to watch. Maybe some patients don't know that they have an allergy and you're noticing these signs: coughing, wheezing, runny nose and eyes, shortness of breath, and then they go into respiratory distress. Then we have what we call anaphylaxis. Okay, notice whatever is highlighted in yellow, again, make sure that you are highlighting that in your lecture guide, or make sure you're filling in the blanks as well. So anaphylaxis, this is the most severe form of immediate allergic reaction. And a death results from closure of the airway by swelling, so they can't breathe. So the treatment is a vasoconstrictor, a form of epinephrine. Okay, unfortunately, there's no real cure that has been identified, and we identify who has the allergy to that latex. We want to make sure we know, is it the patient or is it the staff member? Who's got the reaction? And then we want to prevent it, again, by avoiding using latex. You're going to use the latex-free products. You're going to use a rubber dam, Profi cups, gloves, etc. Okay. Okay, this is important. Everything we're saying is very, very important. This is regarding the waste management in the dental office. Dental offices are subject to many regulations regarding waste management. We have the EPA, which is the Environmental Protection Agency, which regulates medical waste. Dental assistant must understand the types of waste and their disposal. And the first one is the EPA. Then we have the classifications of waste. We have what we call the generalized waste. This one is non-hazardous. This one is non-regulated. This one is discarded in covered containers made of durable plastic or metal typically. Okay. For handling, the container is lined with a plastic bag. Examples, what we call as general waste would be our paper towels we use, our mixing pads when we mix cement, and any type of food containers. That would be called general waste. Okay, so according to OSHA standards, our waste disposable cannot have an open top. It's got to be a closed container. And with a foot pedal would be ideal, so you don't have to touch it. So you push the foot pedal and this will open up, and that's where you put your hazardous waste. Okay, so it cannot be open. Closed container only. Then we have the contaminated waste, which is waste that has been in contact with blood and other body fluids. Examples, use barriers, patient napkins because there's perhaps blood or saliva splash and splatter all over the napkin, gloves, okay, because there might be blood or saliva on the gloves, of course, and 2x2s, any 2x2s that we use. And this is disposed as general waste. Okay, PPE should be worn when handling or disposing. Okay, so we've got our 2x2s, we've got our barriers over the chair, looks like over the X-ray machine as well. This is the patient bib, and then we have our examination gloves. That's considered contaminated waste. Then we have what we call hazardous waste, which poses a risk to humans and the environment. We have, which are, what is considered hazardous waste is our toxic chemicals, okay, which we use in the, when we develop x-rays, when we clean and disinfect the treatment room, in the sterilization area, any types of materials we use, okay, scrap amalgam, okay, fixture solution is what we use for developing x-rays. The lead inside the dental film, okay, that's considered hazardous. And this is important, if we extract teeth that have amalgam in it, that's considered hazardous waste. Okay, here's a slide. So this is the x-ray developer. This is the x-ray fixer. So this develops the x-ray, and this, the fixer keeps the image. It saves the, it saves the image. And then we've got the amalgam. The silver material here is amalgam. Then we've got the extracted tooth, and then we've got the oil inside the x-ray packet. And those are called, what type of waste is that called? Remember? Hazardous waste. Okay. Then we have what we call infectious waste. And that's also known as regulated waste or a biohazard waste. contaminated waste that is capable of transmitting an infectious disease. Now, to be infectious, pathogens must be strong enough. So this is a 2x2 and it's saturated in blood. Okay, that would be considered infectious. And in an insufficient number, so there's a lot of blood on here, so that is infectious waste. It's never disposed in the general waste containers, and it requires special handling and disposal. So examples would be blood and blood-soaked gauze, which would be this picture here. Pathological waste, okay, any soft tissue, extracted teeth would be called pathological. So sometimes when doctors do biopsies, there might be excessive tissue, so that would be considered infectious. Extracted teeth, again, and any type of sharps will be required as infectious. Handling of contaminated waste. So items that contain body fluids should be placed in this is very important, a lined trash reciprocal, okay, but controlled with a fitted lid, should have that red biohazard label on it, should be emptied daily, stored in a locked area, picked up in 7 days. Blood fluid is disposed into an appropriate sewer drain, which is flushed. Okay, here's some pictures of puncture resistant, closable, leak proof, color coded or labeled with a biohazard symbols. Okay, we have our sharps. We have our trash can. Okay, it's got the foot pedal with the closed lid or biohazard label. This is leak proof. Okay, everything's labeled exactly the type of chemical and to let us know that it's biohazard. So disposal of medical waste. You guys should be on page 57 with me and highlighting as we go. Any solid waste that is generalized in the diagnosis, treatment, or immunization of humans. That would be medial waste. Infectious waste is part of the category. Containers must be labeled with that biohazard label, and it should be picked up for disposal. Okay, this is what the truck looks like to pick up the type of waste that we need to dispose of, the medical waste. So it looks like an actual trash truck, but there are different types of trucks that come by to pick up the waste that we need to dispose properly. So guidelines to follow. This is very important. You should never eat, drink, smoke, or apply cosmetics, even lip balm or chapstick, or handle contact lenses in anywhere where a risk of contamination. Essentially anywhere in the office, operatory, sterilization area, in even in the area where you perhaps where employees have lunch, the lunchroom. Okay, the lunchroom you could eat and drink there and possibly apply cosmetics, but anywhere else in the office, even in the front office, you never eat and drink or apply cosmetics. So just in the area that's designated for eating, okay, that would be the area where you would go. to eat and drink. This is very important. Also, you never want to store food or drinks in refrigerators that contain contaminated items. So typically what happens in offices is there's a refrigerator for food and then a refrigerator for different types of materials that are stored. So you should keep your food away from any type of materials, because some materials need to be refrigerated. So it's best to keep them separated from each other. The dental laboratory. So you are learning in dental materials that you need to disinfect impressions, alginate impressions, right? Any type of appliances, okay, say Holy retainers, that would be considered an appliance, or other items sent to the lab and dental office. You want to make sure you disinfect everything before you send it out. The lab surface uses barriers or proper cleaning and disinfecting. Okay, we want to make sure they're barrier protected, because typically some surfaces are very hard to clean. And so that's why we use the barriers. Lab items should be sterilized. Okay, what are lab items? So that would be burrs, any polishing points, any type of rag wheels should be heat treated, disinfected between patients, or discarded, okay, in the lab. So when we get to specialties, you will see some of these types of items. You'll see what rag wheels look like. You're going to see what polishing points look like. You will see what burrs are all about. Those are the type of items that go attached to the hand pieces. You will learn that in chairside, which burrs are which. So they all need to be sterilized. Sterilized meaning they need to go through the autoclave or the chemclave, which we will go into greater detail what those types of sterilization machines are all about. Okay, now some offices use a pre-procedural mouth rinse. Okay, and this is used to reduce the number of microorganisms in the mouth. I know some oral surgeons like to use this mouth rinse before they're going to go ahead and proceed with an extraction or any type of surgery. They like to use these mouth rinses. So what would happen is you would come in and you would rinse out with this mouth rinse before you even see the doctor. And there's no strong scientific evidence behind it that it really it works to decrease the microorganisms. But it's, we know that it does reduce a few microorganisms, may not reduce all of them, but we know it's effective, maybe not 100%, but probably like 75% or higher. Okay, then we have the Mycobacterium tuberculosis, which is TB. A patient may seek dental treatment if they have TB. TB is spread by airborne infective particles when patient sneezes, coughs, or speaks. Can remain airborne for hours. A dental assistant must understand how to manage these patients. Okay, the CDC recommends delaying treating patients with tuberculosis. May become infected if particles are inhaled and travels to the lungs. So persons with latent TB will have a reactive TB test, but they may have no symptoms and non-infectious. So we can see a patient who has TB, but the CDC recommends to delay treating them. So if they have an infected tooth that's considered an emergency treatment. So we would take care of that emergency treatment. And if they have other treatment that needs to be done, we'll wait until the tuberculosis is under treatment and they have no more symptoms to continue with treatment. So we would seek dental treatment for emergency purposes. Then we have the CJD disease, the Creutzfeldt-Jakob disease. Belongs to a group of degenerative neurological disorders. Okay. It's rapidly progressive and unfortunately most likely fatal. And it can affect human and animals. And this is caused by a prion infection. And it could take years for any symptoms to appear. And unfortunately, it's usually fatal after 1 year of the diagnosis. And the CDC has no recommendations in the use of special precautions with a patient with this type of disease. So it's unresolved at this point, it's unresolved. Okay, laser, electrosurgery, plumes, and surgical smoke. So during a procedure, some doctors will use this device. And during the use of some surgical or laser devices, there's a smoke that may be produced, okay? It kind of smells like, the best way I could describe it, smells like burnt hair, okay? It's a really strong, intense smell. And this may create another potential risk because of the smoke that's produced. Possibly infectious material in plume. That's why we use a mask and that's why we use our eyewear. And the CDC has no recommendations for special precautions when a doctor has to use this type of device, okay? And this device is typically used if they need to cauterize tissue, gingiva tissue. And this is what it looks like. I have a picture of what it looks like if I could get to it. Okay, it's an electrical surgical unit, okay? So this is the handpiece. This little attachment are called electrodes, okay? So they come off and we need to clean and sterilize the tips, the electrodes, okay? And this part, the red part is called the grounding plate. And so we wanna put this either behind the patient's shoulder as a grounding, okay? Because we do use electricity and we need to make sure the patient is grounded so they don't get electrocuted. So there's a grounding plate that we place as well. So this is what the machine looks like. And who could use this type of device? It's only the dentist. So it's important that we have our HVEs ready, okay? And to make sure to have our full PPEs because it's going to generate smoke. And that's the plume, the smoke. And it has a really bad smell to it. So we want to make sure that we are safe and protected by wearing our full PPEs. Okay, so here's that slide that I was telling you about the different categories that we went over. So category 1 is routine exposure to blood and saliva. Okay, examples, the doctor, the hygienist, the RDA expanded function, a regular registered dental assistant, and then a dental assistant, right? Because they are at chairside and they work one-on-one with the patient. Category 2 may on occasion be exposed to blood and saliva. That's the front office, the receptionist, and the office manager. They may, at times, if needed, may help in the back. They may help with sterilization. They may help cleaning and disinfecting the treatment rooms. So on occasion, they're exposed. And then category 3, who are never exposed to blood or saliva, that would be the financial manager. They're the ones that do the billing and go ahead and collect finances. And then other office workers, if they have special people coming in doing special duties. sterilizing instruments, filing, they will be under that category. Okay, here's a slide showing treatment in the operatory, the doctor wearing full PPE, okay, the assistant wearing full PPE, even the cap. And so everybody's protected. Ideally, the patient should be wearing safety goggles as well to protect them from splash or splatter or aerosols. This assistant is taking care of, looks like laundry. And notice she's got the biohazard container. It's got a plastic bag and it's got a cover, a sealed cover on it. So looks like she is discarding the contaminated towel. Okay. All right. So that's it for chapter 19. Any questions for me at this point? Any questions? No? We're all good? Okay, so since we finished chapter 19 and there are no questions, I'm going to go ahead and move forward and I'm going to do a little review